Clinical Judgment, Week 5. This week, our client is an obese 64-year-old male that reports bilateral knee pain for the last several months. He's come in to see his primary care healthcare provider. Currently, he has bilateral knee pain, 7 out of 10 on a 1 to 10 pain scale. His heart rate is 94. It's regular. Blood pressure is 150/90. His right knee is reddened and swollen. He has active bowel sounds times 4. His white blood cell count is 9,000. His temperature is 97.8. His respiratory rate is 18. His lungs are clear to auscultation. He is independent and lives at home. His blood glucose is 124. His oxygen saturation is 98% on room air. And he ambulates with a waddling, slow gait. So take a look at these and determine what findings are relevant or most important at this time. Okay, so this is what I've come up with. He has that bilateral knee pain. This could be caused by injury, arthritis. Maybe he has bursitis or an infection or a musculoskeletal disease. The elevated blood pressure can be caused by pain, hypertension, chronic hypertension diagnosis, stress, arteriosclerosis or atherosclerosis, so that high cholesterol diet. The right knee is reddened and swollen. So his knee could have been injured. He may have arthritis, bursitis, infection, or musculoskeletal disease. He ambulates with a waddling, slow gait. This could be due to obesity or musculoskeletal disease or injury. So, what are potential complications of these issues? Well, potential complications with that bilateral knee pain might be immobility. And when we have immobility, we know that we have complications associated with it, such as respiratory issues and or thrombophlebitis. The blood pressure elevation, the CVA, the aneurysm, or decreased cardiac output, the swollen and reddened red knee might be a complication with joint damage if we don't take care of it. Or if there's just some irritation going on there, potentially could lead to an infection. Ambulates with that waddling slow gait. Well, when one area of our body hurts, we tend to compensate by walking in a different way or by uh, taking the weight off of that particular area. So we may be causing some issues in other parts of the body due to that compensation. So, what do you think the most likely explanation for what's happening with this client might be? Well, I think it could be osteoarthritis and definitely hypertension. So, what are these priorities for this client? We need to decrease that blood pressure. We need to, or his elevated blood pressure is a priority. His decreased mobility is a priority. And his pain is a priority. And what are the expected outcomes? What do we expect to come about because of these priorities? Well, hopefully our blood pressure is within normal limits. The joint function and mobility has improved, and the client has minimal to no pain. What members of the healthcare team might be involved in this case? We know we can always say the UAP, the nurse, and the healthcare provider. Those are all kind of go without saying. But who else? Well, how about radiology? Because we probably want some good x-rays, good images of what's going on in those knees. And then how about physical therapy? Is there something else this client could be doing to decrease symptoms and improve mobility? So what actions are essential to meet those expected outcomes? Excuse me. We definitely need to monitor vital signs. We also need to administer analgesics and probably some antihypertensive medications. The analgesics that we would administer would be acetaminophen or NSAIDs. We are not going to give narcotics for this man's pain. We could do ice packs or heat packs, whichever feels the best. Low impact exercise. If you recall, osteoarthritis is caused by repetitive joint stress. And this could be caused by obesity, by repetitive usage, standing, walking, running, could all lead to osteoarthritis. It helps break down that joint over time. So we want low impact exercise, which would maybe be biking or swimming. We need to encourage weight loss. If you recall, this client is overweight, and decreasing weight is going to decrease the stress on the joints. Maybe do steroidal injections to help decrease the inflammation that's going on in the joints. And consult for joint replacement. The one knee that is reddened and swollen has a lot of inflammatory process going on there. That knee may be ready to come out and be replaced by a prosthetic knee. So what are the priorities for this client? We need to get those vital signs within normal limits. And honestly, the only one that was not in normal limits was the blood pressure. So let's bring that down. We need to monitor those vital signs and give antihypertensives. We could also put the client on a low sodium diet and a low fat diet. Let's improve joint function and mobility. We need to encourage low impact exercise to maintain that flexibility of the knee, but with the inflammatory response going, this client may require these steroidal injections into the knee itself to help reduce that inflammation. Minimal to no pain, the analgesics. And again, the steroidal injections can help with that, help decrease the inflammatory response, which will in turn help decrease the pain. And as always, we need to do our evaluation. Did what we do work? And if it didn't work, what do we need to change? What do we need to do differently to achieve our outcomes? Priority client. Is it the client who's diagnosed with a large ovarian mass? Is it the client who is a postoperative left mastectomy who reports edema to the left arm? Is it the client who has a report of a mass protruding from the vagina? Is it the male client who reports an inability to urinate? Well, we have a large ovarian mass that's probably been there for a while. It's been growing for a while. So unless the client is having severe symptoms where the mass is applying pressure in areas that could be really important, such as your blood vessels, etc., that one is not emergent. If we have a client who had a mastectomy with edema to the left arm, we really kind of expect that to happen. That's pretty normal post-op mastectomy. Client who has a mass protruding from the vagina, well, it's kind of important. We definitely need to make sure that that mass stays moist to prevent tissue necrosis. And then we have the client with the inability to urinate. Depends on how full the bladder is, depends on how uncomfortable this client is as to the emergency of this situation. I would say the correct answer would probably be 3. So the nurse is interviewing a middle-aged woman who reports chronic joint pain and stiffness. Which client statement is indicative of early osteoarthritis? What is this question asking? Well, we not only need to know symptoms of osteoarthritis, but early osteoarthritis. Is it my joint pain diminishes after rest and worsens after activity? Is it I have discomfort with slight motion or even when at rest? Is it I have a tingling sensation and sometimes numbness in my joints? Is it there are bony lumps in some of my finger joints? Well, would bony lumps happen in early arthritis? Probably not. Tingling sensation, sometimes numbness in my joints. Would we see this with osteoarthritis? Usually we're going to see pain, not tingling, not numbness. I have discomfort with slight motion or even when at rest. That would be later osteoarthritis. My joint pain diminishes after rest, worsens after activity. Definitely a sign of early osteoarthritis. The nurse is caring for an obese client with osteoarthritis. What is the best rationale for encouraging this client to lose weight? What is this question asking? Well, we really kind of need to know what effect weight has on osteoarthritis. Number 1, an obese person with OA has an increased risk of also developing rheumatoid arthritis. Number 2, obesity interferes with the metabolism of drugs that are usually prescribed to manage OA. Number 3, extra weight of obesity increases the degeneration rate of the hip and knee joints. Number 4, obesity has a negative effect on self-esteem and body image of clients with OA. Okay, as we look at these, OA does not increase the risk of RA. Obesity may interfere with the metabolism of drugs to a point, but probably not. Really, again, the drugs that we're going to be giving for OA would be Tylenol or NSAIDs, and weight does not really play a factor in those. Extra weight of obesity increases the degeneration rate of the hip and knee joints. Well, OA is caused by repetitive stress, and weight adds stress to the joints, so this one is very probable. And yes, obesity does have a negative effect on self-esteem and the body image of clients, whether they have OA or not. But does that really encourage the client to lose the weight based on the OA? Correct answer would be number 3. So which response from a client with advanced osteoarthritis alerts the nurse that the client is having a problem coping with the image and role changes related to disease progression? What is this question asking? Well, basically, what are some negative uh, issues that the client may have? What are some ways that negativity regarding circumstances may be expressed? Potentially could be what the question is asking. I used to be a playground assistant. Now I work with children who need help with reading. I'm a musician and my instrument is the piano, so I get a lot of enjoyment going to concerts. I used to work in the garden, but my joints are so stiff I mostly sit and look out the window. I must be getting younger. I used to tie my shoes. Now I'm using Velcro closures just like my kids. Well, as you look at these, look for the answer that is promoting negativity. Question number or response number 1, the client is now uh, working with children in a different manner. Question number 2, client may not be able to play the piano any longer, but goes to concerts, so can still enjoy uh, the music. The response number 3, the client used to garden and now mostly just sits and looks out the window. That's not really a positive response. And question 4, you know, used to tie the shoes, but now they're using Velcro closures. It's just a way of managing the symptoms of osteoarthritis. Correct answer, number 3. Nurses evaluating lab results from a client with osteoarthritis. Which lab results could the nurse expect to find elevated? So, question is asking, well, we could look at the pathophysiology of OA, or potentially what labs may show us that a client is having issues with osteoarthritis. White blood cells, including neutrophils, basophils, macrophages, and eosinophils, erythrocyte sedimentation rate, and high sensitivity C-reactive protein, electrolytes such as potassium, calcium, magnesium, phosphorus, and sodium, and partial thromblastin time, and international normalized ratio, the INR. Well, as you're looking at this, again, if you kind of know what's going on with osteoarthritis, we know that there's a lot of inflammatory response going on through degeneration of that joint. And inflammatory processes are going to be reflected with our elevated erythrocyte sedimentation rate, the ESR, and the C reactive protein, CRP.